I do want to quickly bring into the conversation the Chief Medical Director of a medical marijuana clinic, Dr. Bonnie Goldstein. You prescribe medical marijuana, and Dr. Orton raised some really interesting points of when might you be able to substitute a more dangerous medication with one, if appropriately prescribed, marijuana could provide some benefits. How often are you seeing this in your clinic?
So in my practice, I'm absolutely seeing patients get off of prescription medications. Opioids is the #1. Other pain medications like nonsteroidal anti-inflammatories, anxiety medications, sleeping pills for sure. Also other things that for some patients, they're on multiple medications for certain conditions, and what's happening is they're able to at least back down to maybe 1 or 2 instead of 3 or 4. One of my patients even called cannabis the one-stop shop because she was on pain medicine, anxiety medication, depression medication, and sleeping pills. And she was able, at the age of 27, she was on all of those medications and was able to get off.
Specifically in the elderly, I'm just curious, are there more concerns about, say, side effects, or do you have to think about the dosing differently if this is something a senior is truly considering?
We have to be very careful with dosing, and the general rule of thumb in the cannabis industry is start low and go slow. Start very low dose and titrate up. But what I also recommend, which many people don't realize, is that there's a lot of combination products out there that have both CBD and THC, and studies show that they work better when they're together. So not all of one or all of the other. And what happened in California is we kind of went one way towards the THC as medical cannabis moved on, and now CBD is being reintroduced. Combination products allow the CBD to buffer a lot of the unwanted side effects of THC, but still help with the underlying medical condition.
Should seniors who are already on other medications, are there specific interactions they should be aware of?
Yes, there can be interactions, and certainly so things like blood pressure medication. If you take too much cannabis on top of your blood pressure medication, your blood pressure can go down and you are at a risk of fall, especially if you're getting up out of bed to use the restroom or something like that. We also know that blood thinners can interact with some of these medications, and many elderly are on those. And so it's always good if you're on other medication to have a physician who understands cannabis to at least go over medications with you so that you can make sure you can avoid those kinds of interactions.
Let me raise that red flag, because that is the one concern I had watching this segment, and my one concern as I've seen the evolution of the marijuana industry rapidly growing over the last few years, it's that I do believe that marijuana has a valid place in medical treatment. We will only learn more and more about how to dose. More doctors will specialize as you do. But then there's this other side of it where it's just one big party. How do we bridge that gap where people, all of us, take marijuana seriously as a medical treatment?
Well, I think for most people, you know, if you overdose on cannabis, it's very psychologically uncomfortable. It's trippy, what I call it. And I tell people, once you do that, you're never going to go back there again. Most people know how much is too much, and they usually figure it out. But in general, I think that some of the new regulations coming out are good regulations. Edibles should not have 1,000 milligrams in them. It should be limited to a smaller amount, because some people see a candy bar package, and you even showed it up on your screen, 180 milligrams. That's many, many doses for most people. That is not, and most people see a candy bar and say, oh, I'll eat the whole thing. So unfortunately, without regulations, it got a little bit crazy, but I think the regulations are going to help, especially with the edibles. In general, with the other types of compounds that are out there, like topicals or inhaling, most people are able to regulate it and figure out what works best.
And I'm glad you said that.
Edibles with kids and adults too. Adults like their sweets.
Because you both seem concerned that they were lowering the dosage amount, but 10 milligrams of THC is a significant dose for someone who's naive to it. I mean, I would argue that that's maybe too much. If you're trying, you know, that's a big dose. So to me, that's a good development. And I can tell you expressed some concerns from the elderly that they were putting that requirement in place.
It sounds like the seniors you were discussing know how to break it off and save it.
A lot of it told me it was trial and error themselves.
So for our viewers, how did they find, like, how do your patients find you? Where do they go for resources on this so they can safely think about incorporating this if this is something they're open to?
Well, most people are going online and looking to see who might specialize in this. There's just about a medical cannabis conference almost every week somewhere in the United States where you're going to find doctors that are learning about this. It needs to be in the toolbox of every doctor now, because if you're practicing, you know, family practice and you're writing prescriptions for all kinds of different medications, this is just another tool in the toolbox to be able to talk to your patients about. And again, doctors are free to talk to their patients about medical cannabis as long as they don't misrepresent represent anything. I think many doctors think they'll put their license at risk if they talk to their patients about this, but they will not. We are free to speak about it with our patients.
I will say, Leslie, you've outdone yourself. This was the
Fascinating. We all learned so much.
of all the investigations you've done, this was the highlight.